guys are going to find mnemonics one by one. Okay, so like I'll give you task for each drug. You guys are going to find a better mnemonic so that all of your like the classmates can just get help out of that, right? Did you guys get me? Hello, hello.
Hello.
Doctor, could you please repeat that?
Like I'll just discuss the drugs. There are some easier drugs which do not need any mnemonic in order to memorize that, right? But some of the drugs, like we are dividing these drugs into two segments. First of all, we are going to discuss the normal immunosuppressants, which are quite easy. You guys would understand that. Secondly, we will be discussing some immunotherapy, that is involvement of, you know, the monoclonal antibodies. So they are very difficult to remember. So I'll give you you people tasks to find mnemonics in order to memorize those drugs, right? Just search in the internet or anyone who have better mnemonic, and just you guys are going to tell me here, right? Okay, you guys will understand. Just wait for that. Okay, so let's start our session. So, so today we are going to talk about immunosuppression. Can you guys tell me that what does the name indicates? Why am I suppressing the immunity?
Sir, please share your screen.
Oh, sorry. Stance is going to get some signals. Like you guys know, for example, if I'm sending some signals inside the cell, so there are different pathways for that, right? Hello. So it's going to stimulate a protein that is basically calcineurin. Okay, calcineurin is going to go and it's going to activate NFAT. What is NFAT? Nuclear factor of activating T cells. Like this substance, you can think it's going to act on your nucleus, right? And inside the nucleus you have DNA, right?
Yes.
It's going to tell your DNA to produce something in order to what? Increase the T cells concentration, right?
Yes.
Okay, so this is going to act on your DNA, and as a result of that you are going to see DNA transcription, and as a result of that some genes are going to be activated. These genes are going to produce what, guys? Interleukin 2. Okay, And what's the role of interleukin 2? Yes, anyone can tell
Pro-inflammatory.
us? It's pro.
Pro-inflammatory.
Okay, it's pro-inflammatory. Like it can activate other kind of inflammatory cells, as well as it also have an autocrine effect. It means it would activate your T cells again, right? It can again activate this T cell because IL-2 also have an autocrine effect, right?
Yes.
Okay. So this IL-2 is going to bind to a receptor. Okay, what's the name of that receptor? Simple. That is IL-2 receptor.
To receive.
Okay. Then IL-2 receptor is again going to send some intermediate kind of substance or intermediate kind of protein. Okay, like that. Okay.
mTOR.
Oh yes, that is mTOR. mTOR is going to go and is going to increase the concentration, simply you can say, of your T cells, or increase growth of your T cells, increase T cells growth, right? So
Yes.
let me repeat it again. Antigen presenting cells are going to come in contact with CD4 cells. It's going to stimulate one of the intermediate protein, that is calcineurin, right? Calcineurin is going to activate your nuclear factor of activated T cells. They are going to go, as the name indicates, nuclear factor. So it has to do something with your nucleus, inside nucleus your DNA. It's going to activate some of your genes for IL-2. Once IL-2 is produced, IL-2 is again going to bind to your IL-2 receptor. It's going to activate or stimulate mTOR. mTOR is going to increase the T cells growth. Simple. Okay, anyone who can just tell me this pathway? Yes, anyone who can just revise this pathway for us? Hello?
Okay. I will do it.
Yes, thank you, doctor.
First, at all antigen presenting cells interact with the naive CD4 T cells
Okay.
that will release a mediator that called calcineurin. Calcineurin
Yes.
will binds with the NFAT, nuclear factor of activated T cells. Then it will release it will cause DNA transcription that will release L2 pro-inflammatory cytokines.
Okay.
L2 L2 it have a feature that it can auto activate the T cells itself.
Okay.
It will binds on L2 receptor that will release a mediator called mTOR, and this will cause cell growth and proliferation.
Okay, perfect. So for example, if I am blocking off this mediator, right, it means all of the pathway that is next to this mediator is going to block, or it means I will be producing less IL-2. If I am producing less IL-2, it means I am suppressing the T cells growth, right? So
Yes.
for example, if this something, if I am giving some drug, so I can just name it as it's an immunosuppressant, right? Because I'm suppressing the immunity, I'm suppressing the activity of your T cells growth. So it would be one of
Calcineurin
immunosuppressant.
inhibitor.
Yes, calcineurin inhibitor. So what are the two calcineurin inhibitors? You guys must know, that is cyclo.
Tacrolimus and cyclosporine.
Yes, cyclosporin plus tacrolimus. Okay, but cyclosporin and tacrolimus are first of all going to join with some kind of proteins, which is very high yield. You guys must remember that. Cyclosporin, when combined with a protein that is cyclophilin, then it's going to deactivate your calcineurin. Similarly, tacrolimus, whenever it's bound to a protein that is known as FK506BP, once it is combined with FK506BP, then it's going to suppress your calcineurin, right? Okay.
Yes.
Okay. So let's talk about cyclosporin and tacrolimus. Okay. So we have discussed cyclosporin and tacrolimus. Okay. So what's the mechanism of action? Cyclosporin is going to bind with cyclophilin. It's going to bind with cyclophilin, and as a result of that, it's going to decrease your IL-2, right? Tacrolimus is going to bind with your FK506 BP. Then it's going to suppress your IL-2. Okay, so let's discuss some of the high yield indication. Okay, so basically we give them in transplant rejection prophylaxis. Like we have already discussed, like during transplantation you can have phenomena of rejection. So in order to, like before transplantation, just suppress their immunity in order to have less chances of rejection simply. Okay, you can also give them in psoriasis. Okay, but what's the adverse effect? You guys must know that the adverse effect is nephrotoxicity. Nephrotoxicity and neurotoxicity. Like it's going to damage your nephron and neuron. Damage your nephron and neuron. Okay, so both of these drugs are like kind of same. They have same mechanism of action. They are blocking of your calcineurin. But how to differentiate very high yield? The side effect of cyclosporin is basically your gingival hyperplasia. Like cyclosporin can cause gingival hyperplasia. So for example, in boards, if you have a question that we have a patient who is on immunosuppressant and he have gingival hyperplasia, right? So this drug is going to bind to which protein in order to inhibit your in order to inhibit your calcineurin. So it have to bind with cyclophilin, right? Hello.
Yes, doctor.
Yes.
Okay. So this was all about cyclosporin and tacrolimus. Okay, they are basically used in transplant rejection prophylaxis. They damage your nephron, they damage your neuron, and one of the side effect. Okay, hirsutism as well. So side effects of cyclosporin is basically your gingival hyperplasia and hirsutism. Anyone who can just give us a quick overview of this drug? Okay, guys, an important tip: just participate in this class, revise it again and again, again and again. This is going to help you remember these drugs.
Can you hear me?
Okay. Hello. Yes.
So can I go ahead?
Yes. Yes. Sure.
So immunosuppressant, we are talking about immunosuppressant drugs, and they are given in conditions like which we have transplant rejection and autoimmune diseases destroying our own system. So their mechanism of action is that it is an antigen presenting cells, and they present themselves through MHC class 2 proteins, class C MHC class 2, yes, proteins, and then they activate CD4 T cells, and
Yes.
after that they act on calcineurin, and by the calcineurin then activate an FAT which acts on DNA, and it inhibits the transcription, and then
Okay.
IL2 is it also inhibits IL2. No, it releases intraleukins,
Okay. Yes.
and
Interleukin two.
then which interleukin 2, which then activates mTOR, and it increases T cell. What's that?
Okay.
It increases T cell. Hello,
Yes. Go
what's
ahead,
that? I'm
doctor.
sorry. Yes. So, and then we have two drugs. One is cyclosporin, one is tacrolimus. So, the cyclosporin acts through cyclophilin, and then tacrolimus acts by activating FKF506B2. So, but both of them ultimately acts on interleukin 2, and then their side effects. So, for the cyclosporin, which is high yield, it causes hirsutism and gingival hyperplasia, and then tacrolimus, it causes nephrotoxicity and neurotoxicity, and they were also
Okay.
given in psoriasis.
Okay. Perfect. Okay. Now moving along this pathway, what if I block the mTOR? For example, if I'm blocking mTOR, again, what happens? still your IL-2 is being produced, IL-2 is released, but IL-2 cannot increase your T cell growth, right? So still I'm suppressing the immunity, right? So the immunosuppressant which is acting on mTOR, what's the name of that? That is sirolimus. Okay, sirolimus. Okay, before inhibiting your mTOR, it also have to bind to some protein, right? And what's the name of that protein? Just remove the this 506. That is only your FKBP. Okay, just remove these numerical numbers. You will get the protein associated with sirolimus. You know both of these sound same, sirolimus and tacrolimus, right? But tacrolimus is going to inhibit your calcineurin. Sirolimus is going to inhibit your mTOR. Okay, what's the binding protein? It's FKBP, right? Hello.
Yes.
Okay, so then we have mTOR inhibitors. Okay, so mTOR inhibitor is basically your sirolimus.
Sirolimus.
Okay, and what's the name of their binding protein?
FKBP.
FKBP.
Okay, FK and BP. Okay, so it is also used in transplant rejection. Okay, it's also used in transplant rejection. But what's the best part of it? It do not cause nephrotoxicity. It do not cause nephrotoxicity. Okay, so it do not cause nephrotoxicity. Right? So, like for example, if we are giving like you can have a question like that. For example, if you are giving a patient, for example, he is like close to his renal transplantation, and we are giving him cyclosporin, and ultimately he develops some nephrotoxicity. For example, if his creatinine rise, we have switched his drugs from tacrolimus or cyclosporin to sirolimus. Why? Because sirolimus do not cause nephrotoxicity, right?
Yes,
Okay.
doc.
Okay, what's the adverse effect? It causes pancytopenia. You guys must remember that. It like inside your bone marrow, it can act there. It can just block off the pathway as well, and as a result of that, you can see pancytopenia. Simple. Okay, so we have discussed the blockers of calcineurin and mTOR. Okay, what if we block the IL-2 receptor? We can also get the same effects, right?
Yes.
Okay, but you guys know, for example, if I am blocking a receptor, so then I need antibodies for that. Like simply you can relate it with myasthenia gravis because there the receptor was blocking and we need antibodies for that receptor in order to block that receptor, right? In order to block the downstream effects, right? So in order to block this receptor, I need an immunosuppressant, but that would be a monoclonal antibody, right? Because antibodies does that work very good, right? So,
Yeah.
what's the and you guys know whenever we will be talking about monoclonal antibodies, they are simply a recombinant antibodies which are going to target certain receptors and inhibit that receptor and the downstream effects. And whenever we have monoclonal antibodies, you know, in the end you are going to see a suffix that is MAB, right?
Yes.
Hello. Okay. So here some MAB is used, but what's the name of that MAB? That is basiliximab.
Isn't
Basiliximab. Okay, basiliximab. So anyone who can just just find a mnemonic for IL-2 inhibitor, that is basiliximab. Anyone, just go and find some mnemonic. Anyone who have in their mind who can share.
Brazil map.
Okay, Brazil
Maybe.
map. Okay, it's how to associate with IL-2.
It can be by map.
Okay, it can, yes, basiliximab or bimap.
By map.
Okay, yes, this is a good mnemonic. So bimap or basiliximab. Okay,
So we
basil.
can relate it to I live in Brazil, uh, IL2.
What? Just repeat it, please.
We can, I live in Brazil,
Okay,
I live,
I live in Brazil.
yes.
Okay, I live in Brazil. Okay, so I and L have two words, so it's IL2. Simply you can like okay, it's a good mnemonic. I live in Brazil. Okay,
Brazil.
so I live. You have two words before Brazil, so IL2. Okay, that is IL2 for Brazil, basiliximab. Okay, is that good mnemonic or not, guys?
Yes.
Okay, so I live in Brazil. It means IL2 in Brazil, basiliximab, right? Okay, so basiliximab is going to block off your IL2, right? And it's a monoclonal antibody, right? It's directly going and it's sitting on the receptor, and ultimately it's going to inhibit the downstream effects, right? So, okay. Hmm. Okay, so we can also use it in transplant rejection prophylaxis as well. So it's basically okay, IL2 inhibitor, receptor inhibitor. Again, we can use it in transplant rejection, as we know that immunosuppressants are basically used in transplant rejections in order to avoid transplant rejections, right? Okay, but what's the adverse effect? Remember, guys, you are going to see hypertension and edema. Okay, and you know it's an example of type 2 hypersensitivity, right? Because your antibody is directly setting on the receptor, so it's an example of type 2 hypersensitivity, right?
Yes.
Okay, you can simply like edema, ed, or edema, die for 2, IL2, right?
So we can memorize it by saying that in Brazil, when we live, we have hypertension and edema over there.
Okay, so you can like simply say that I live, okay, I live in Brazil, and I ate
And
some
develop,
salty food.
and develop.
Okay, I ate some salty food there, and so salty food should indicate hypertension. Okay, hello.
Yes, doctor.
Okay, so this was all about your immunosuppressant, but one drugs which I want to associate here, like it isn't an immunosuppressant, but it is the best place where we can discuss this drug. You can also have recombinant IL2 as well. Like for example, I can give certain people IL2 simply. What's a recombinant form of IL2? That is your aldesleukin. It's not an immunosuppressant, guys. I'm just adding another drug. This is the best time which like we can integrate this drug. So, for example, if I'm giving an interleukin in like recombinant IL2, it means I'm doing the opposite. It means I'm not suppressing, I'm just exaggerating my immune response, right? For example, you can simply think of, for example, if one have carcinoma, okay, and for example, someone have melanoma, carcinoma, so I can just increase their immune response against these cells, right? Hello?
Yes.
Like any malignancy, you know what happens in malignancy? You have like cells being formed abnormally, right? So,
Yes.
what can I do? I can just increase my immunity against these cells in order to cause destruction of these cells. So, what can I do? I can just give them IL2, recombinant IL2, in order to increase immunity, because what you guys know what's the function of IL2? It's going to increase the T cell growth. So what's the recombinant form of IL-2? That is aldesleukin, right? And aldesleukin can be given in renal cell carcinoma and metastatic melanoma, right? Okay. So anyone who can just give us an overview of these drugs. Okay. Okay, I just found a good mnemonic. Okay. I live in Brazil, and you guys should remember that Brazilian are fat. Okay, they are fat. So
but
okay.
they are not fat.
Sorry if someone get offended. Sorry for that. So they are fat. So they avoid. Okay, those who have obesity, they are increased risk for hypertension, right? So they avoid eating salty food. So fat for edema, okay, and salty food for your hypertension, IL-2, basiliximab. Simple. Okay.
But the Brazilians not fat at all.
Okay, okay, okay. Just assume that they are fat. Okay, I'll be giving you an example of that, but just leave that. Those who understood. Okay, okay. So, I live in Brazil. Okay, okay, okay. They are fat, so they avoid eating salty food. Okay, so fat for edema. So IL-2 inhibitors, that is basiliximab, causes edema and hypertension. You guys should write down this mnemonic because we we just worked a lot in order to make this mnemonic. Okay. Anyone who can just give us an overview of this complete pathway? I'm just hiding it. No, Dr. L Futures, please. Okay, Dr. Ramiz, are you here? Dr. Ramiz was requesting for um, immu- like these immunosuppressants. So where is Dr. Ramiz? Okay, he's absent. Wow. Okay, anyone else? Dr. Zainab, can you just give us an overview of these immunosuppressants?
Yeah.
Yes. Just start with the pathway, just be quick and just tell me the immunosuppressant, their binding proteins, and what does that did, side effects, their uses.
Okay, first antigen presenting cells take the antigens and put it in MHC class 2 molecules and present it to CD4 T cells.
Okay.
And then when it binds with the receptors, this activates a protein known as calcineurins, and calcineurins also work on another protein known as NF80, nuclear factor activated of T cells. And then this protein works on the DNA and lead to interleukin 2 productions. And when interleukin 2 is produced, this works on the receptors on T cells and lead
Okay.
to and work on mTOR proteins and that lead to T cell growth.
Okay.
And the drugs which are working here is first drug is cyclosporins and tacrolimus. These two drugs are working on calcineurins, but they do not directly inhibit calcineurins. Before affecting calcineurin, they binds with another proteins. Cyclosporin is binding with cyclophilins and decrease interleukin T productions, and we give it in um,
Transplant rejection.
transplant prophylaxis. And
Okay.
also tacrolimus also bind with FK506BP, and also this decreases interleukin 2 productions.
Okay.
And the side effect of these drugs are nephrotoxicity and neurotoxicity, and yes, nephrotoxicity and neurotoxicities are the side effect of these drugs. And
Okay. I
cyclos,
want to
yes,
ask you a question. Can you just tell
okay.
me that drug which do not causes nephrotoxicity if I want to switch the cyclosporins? Which drugs am I going to give?
Pyrolimus,
Yes, perfect. It's mTOR inhibitors. Perfect.
yes. And cyclosporin also causes gingival hyperplasia and hirsutism.
Yes.
And the other drug is mTOR inhibitors. mTOR inhibitors is sirolimus, and we can give it. It does not cause nephrotoxicity. It is also used as for prophylaxis of the of transplant rejection.
Okay, perfect.
And but the adverse effect is pancytopenia.
Perfect.
And the other drug is interleukin 2.
Okay, just
receptor.
discuss it via mnemonic.
Oh, I don't know the mnemonic.
Okay. Okay, just tell it.
Okay. An interleukin 2 inhibitor.
Okay.
And this drug is
Yes, you need mnemonic now. I live in Brazil. Brazilian are fat and they avoid salty
okay.
food. Brazil for basiliximab.
Basiliximab, and it blocks interleukin 2 receptor.
Okay.
And the side effect is hypertension and edema.
Okay. Perfect. So, okay. So we have discussed. Okay, this was the all the drugs which are involved in this pathway. Now, let's move to another pathway. Okay. For example, you know what happens in acute inflammation. We have already discussed the pathway. Please tell me. Okay. In acute inflammation, for example, this is your cell. It's going to be activated by toll-like receptor PAMs. Okay. It's going to make a transcription factor that is NFKB, right? Hello? Hello? Can you guys hear me?
Yeah.
Okay. NFKB. NFKB, what NFKB is going to do? NFKB is nuclear transcription factor. It's going to go into your nucleus and ultimately it's going to release your certain cytokines. Okay, that or interleukins. That is interleukin 1, IL-1, IL-6, and your TNF, right? And these IL-1, IL-6, and TNF are going to attract all of your inflammatory cells, right? Hello?
Yeah.
Okay. So what if I inhibit this NFKB? It means I'm decreasing the recruitment of inflammatory cells, right? If I am decreasing the recruitment of inflammatory cells, again, this drug would be an immunosuppressant, right?
Yeah.
Okay, and you guys know that drug. What's the name of that drug? Yes. Okay, it's not a drug.
Glucocorticoid.
Yes, they are glucocorticoids. Okay, those steroids. So they can freely enter into your cell because they are steroids like dissolve. Like once they enter into the cell, they are going to inhibit your NFKB. Okay, so can you just give me examples of glucocorticoids? Yes, prednisone, dexamethasone. Hello.
Beta
Yes.
methazone.
Okay, beta methasone. Okay, perfect. It's going to inhibit your NFKB, right? Okay, what are the indications? High yield indication. We are going to give them into asthmatic patients, right? One who have asthma. Hello? Did you guys remember that? We have already did it. Hello?
Yeah.
Yes.
Okay. So this can also be used in certain acute inflammatory states. Okay, what are the adverse effects? You guys know. If I am just giving a lot of glucocorticoids, so it can cause a syndrome.
Cushing syndrome.
Perfect. It's going to cause Cushing syndrome, right? And secondly, what's the effect of glucocorticoid on your bone?
Osteoporosis.
Yes, perfect. It can also cause osteoporosis. Okay. So, what are the other adverse effects? It can also cause hyperglycemia, right? Okay. It can also cause amenorrhea. Okay. So, it can also cause leukocytosis. We have already discussed this phenomena. Anyone who is going to tell me that? How does
It
it
block
cause?
means the leukocyte cannot go to the tissues. It increases in the blood.
Yes, how? We already did it. If you guys remember the bats sitting in the cave, what happened, guys? Hello? Your pulmonary vasculature, they have neutrophils just sitting like bats, right? Bats in the cave. Okay, what does glucocorticoids do? That glucocorticoids basically inhibits this adhesion molecules. So what would happen? All of these neutrophils are going to enter your blood. As a result of that, the level of WBCs or neutrophils arises, which is known as leukocytosis. Simple. Hello, guys, are you getting it?
Yeah.
Okay, just please give me a response. Okay, so this was all about glucocorticoids. Now another thing, for example, you know that, okay, another drug class. Okay, just give me a second. Okay, so for example, this is your cell, right? So inside your cell you have DNA. DNA is made up of purines, right?
Yeah.
If I am giving something or some drugs which are inhibiting these, the formation of purines, right, or which is inhibiting the synthesis of purine, it means your DNA won't form. If your DNA isn't forming, let's suppose you can take an example of your B cells, your T cells. If the DNA isn't forming, it means they cannot replicate, right?
Yes.
It means these drugs are again immunosuppressant. Okay, so what's the name of that drug? That is your azathioprine. Azathioprine is going to be to enter into a cell. It is going to be converted into 6-mercaptopurine, right? And it's going to
Yes.
inhibit your purine synthesis. If you have inhibition of purine synthesis, okay. So first of all, like in the purine pathway, what happens? Okay, for example, if you are normally synthesizing the purines, then what happens? You are going to see an activation of IMP. What is IMP? Inositol monophosphate pathway, right? And it's going to form your guanine and, guys, adenine, right?
Adenine.
Yes, and these adenine and guanine are going to help in formation of your DNA, right? So for example, if I'm inhibiting this purine synthesis, what is the enzyme which is basically involved in this purine synthesis? That is PRPP aminotransferase. Okay, so for example, okay, this azathioprine is going to be converted into 6-mercaptopurines and it's going to inhibit this enzyme. If I'm inhibiting this enzyme, it means we won't be forming purines. If I'm not forming purines, it means DNA isn't formed. It means it cannot replicate. Again, they are immunosuppressant, right? Okay, so this IMP, whenever you have, okay, so it means both the level of adenine and guanine are going to be decreased. If I am blocking the pathway somewhere here, okay, so the IMP pathway, you have another enzyme that is IMP dehydrogenase. Okay, what IMP dehydrogenase is going to do? It's going to convert. It's going to form your guanine, right? So we also have another drug that is mycophenolate, and it's going to inhibit this enzyme. It means, for example, if I'm giving mycophenolate, it means I'll be seeing less guanine being formed. If less guanine, again, less DNA synthesis. But how to differentiate both of these drugs? If I am giving azathioprine, it's going to be converted into 6-mercaptopurines, and it's going to inhibit the this, right? That is PRPP. So I would be seeing both decrease in guanine and adenine. But if I am using a drugs that have downstream effect on your guanine, so it have more effect on your guanine and less effect on your adenine, right? So this is the difference. So now let's discuss the okay, the drug class that is purine inhibitors. Okay, so what are the examples of purine inhibitors, guys?
Azathioprine microphenolate. Phenolate.
Okay, mycophenolate. Okay, another thing. For example, we have already learned yesterday that you need yes, hydrofolate for DNA synthesis as well, right? For example, if I am inhibiting this dihydrofolate, what's the drug? Methotrexate.
Otrexate.
Again, you are going to see less formation of DNA and less replication, and it can be used as immunosuppressant. Simple. So what are examples of purine inhibitors? Azathioprine, okay, 6-MP, mycophenolate, methotrexate also you can say. So basically they indirectly, they inhibits your which enzyme?
PRP.
Dihydrofolate reductase.
Okay. And mycophenolate.
IMP dehydrogenase.
Okay. IMP. Okay. DH. Okay. And what are the downstream effects? Guys,
Increase
you can.
Inhibition of
DNA and cell
purine
replication.
synthesis.
Okay. Another thing you guys must remember, you know this 6-mercaptopurine is basically metabolized by which enzyme?
Xanthine oxidase.
Okay, xanthine oxidase. So, for example, okay, what's the drug which is basically given in order to inhibit your xanthine oxidase?
Allopurinol.
Okay,
Allopurinol.
allopurinol in gout, right?
Yes.
Okay,
Yes.
for example, if a person is having gout and like I'm just giving him allopurinol in order to inhibit oxidase, and at the same time I'm giving him azathioprine, right? So there is increased chances of toxicity of 6-MP, right?
Yes.
Okay, you guys
Yes.
must know that.
Or
Okay.
in tumor lysis syndrome. Okay. Also.
Yes, tumor lysis syndrome as well. Okay, so this was all about the drugs. After right after these classes of drugs, we are going to discuss the monoclonal antibodies. So anyone who can just give us an overview of glucocorticoids along with purine inhibitors. No one?
Okay, glucocorticoids will inhibit NF-κB that will
Okay.
decrease the release of pro-inflammatory mediators L1, L6, TNF alpha.
Okay.
Steroids used in asthma treatment, and it has a side effect like Cushing syndrome, osteoporosis, and leukocytosis.
Perfect. Okay, what are some drugs that are your purine inhibitors?
Purine inhibitors like azathioprine or mycophenolate.
Okay.
Azathioprine will convert it to 6-mercaptopurine that
Okay.
will inhibit BRPP amido,
Transfer.
amidotran, amidotransferase enzyme that will inhibit converting purine to IMP to adenine guanine, so will decrease DNA replication.
Okay. Perfect. What about
Myco-
mycophenolate?
Mycophenolate will inhibit IMP dehydrogenase that will that enzyme normally works to converting IMP to guanine, so it
Okay.
also will lead to decreased DNA replication.
Okay. Perfect. So this was all about immunosuppressant. Guys, did you understand? Is this lecture helpful or not? I am not getting a good response from you guys. What happened?
Yes, it's helpful.
Well, shall I revise it? Anyone who didn't understand?
Sir, I have a question.
Yes.
Have you discussed leukemias in yesterday class?
No,
Sir.
we haven't discussed leukemias. So today, like I was just making the, you know, assessment. I was on that. So we are going to discuss it in tomorrow's lecture. Tomorrow we will be doing, like, it's my fault. Sorry for that. I haven't just prepared the lecture and I didn't have, like, I have just, delayed my class too. So we'll be discussing that in tomorrow's lecture.
Okay, sir. Thank you.
We'll just extend the lecture. Okay, so first of all, we are going to do some high yield stuff from based on MSK, because tomorrow we are going to start our MSK. And along with that, in the end, I'll just take some extra time for white blood cells. Okay, like you guys know that it's quite a rigorous kind of schedule. So sometimes I also lag behind. So sorry for that. Okay, but I promise we'll be doing that. Okay.
Sir, these picturized lectures on micro are very helpful for us. So, can you discuss biochemistry as well later in this marathon?
Dr. Maheen, yesterday I told you guys, like, today there was going to be our white blood cell lecture today, right? But you guys were requesting for this drug, so that's why I just skipped that lecture, and I'm like discussing these. Like, this was your homework, if you guys remember. I just told you to activate your cards, flash cards. Like I cannot cover each and everything, but I'm trying my best. Till now, I have covered each and every stuff. Like you guys know that mostly these lectures, like the other kind, the lectures are basically focused on high yield points. But here in this lecture, I'm trying to like discuss each and everything. Like I'm not skipping anything. So for that reason, like it would be quite difficult for me to get time for the biochemistry, but I'll try my best. Okay.
Hello, sir.
Hello. Yes.
Sir, can we do anti-cancer drug?
Can we do
Anti-cancer.
anti-cancer drugs? Okay, we
Sir,
will do that. Okay, we will do anti-cancer drug as well. But today, okay, you guys told me to do immunosuppressant or anti-cancer drug, right?
sir, I messaged about anti-cancer drug.
Okay, I was thinking of that. You guys are asking for immunosuppressants.
Sir, today's lecture is also very helpful.
Okay.
Uh, can you please take a lecture on anti-cancer drug?
Yes, I'll take. But Dr. Mehreen, before giving you lecture of anti-cancer drug, you are going to give us an overview of all of these drugs. Yes.
Okay. Sir. What?
Yes.
Very beginning.
Yes, doctor. Just give a quick overview. Just be quick.
Sir, there is a
Calcineurin
drug,
inhibitors, names. mTOR
uh,
inhibitor, names. IL-2, names. Function.
cyclosporin and tacrolimus, which are the
Okay. Cyclosporin is going to combine with which protein? What's the name of that?
cyclophilin.
Okay, guys, listen. It's going to be a mini boot camp. Okay, cyclophilin. Tacrolimus is going to bind to which protein?
FK506 binding protein.
Okay, perfect. Okay, it's going to inhibit your calcineurin, right?
Yes.
Okay. What are some of these drugs are basically used in prophylaxis of?
Plasma rejection.
Okay. What's the side effects of these drugs?
Cyclosporin causes hypnotism, and cyclosporin also nephrotoxic.
Okay. Gingival hyperplasia.
Ginger
Good.
yes, very
Okay.
highly.
What about mTOR?
Uh, I'm talking about is sirolimus,
Okay. What's
which
the
same
protein?
the same the share protein that is sacrobus uses FK binding protein
Okay. And why is it good as compared to that of calcineurin inhibitor?
because it's not nephrotoxic.
Perfect. Okay. Okay. I live in Brazil and fat and salty food.
Yes,
What's that?
interleukin 2 inhibitor that is basiliximab,
Okay.
which is a monoclonal antibody.
Okay. Perfect. Then
Uh,
it causes what are adverse effects? Fat and salty food. It
yes,
causes edema,
edema and hypertension.
hypertension. Perfect. Okay. Then you have your glucocorticoids.
Glucocorticoids have a free access to the nucleus and they uh, inhibit the NFK protein.
Okay. NFKB transcription factor.
Yes.
Then
Then
what are the adverse effects?
adverse
Their
effect
indications.
neutrophilia,
Okay. Perfect.
asthma,
Leukocytosis. Okay. Good.
osteoporosis,
Okay.
or
Okay. Perfect. Okay. What about purine inhibitors?
there are two protein inhibitors, allothioprine and mycophenolate. Allothioprine is going to inhibit our phosphorylated transferase enzyme,
Okay.
and the mycophenolate inhibit the IMP, and in the end, it inhibit the guanine
Okay.
production more.
Okay. For example, if a
Allothioprine,
person is on allopurinol.
huh, we do not give allothioprine because it causes a more toxic effect.
Okay, perfect. So let's have 5 minutes of break. Then we are going to start the monoclonal antibodies, and these are going to be like tough. Okay, we'll be doing some high yield monoclonal antibodies, and you guys just get prepared for making some mnemonics, right? Okay.
Okay, sir.
Okay, so let's have 5 minutes of break. Then we are going to start our monoclonal antibodies. Okay, so let's talk about biologic immunotherapy. So we have already discussed the concept. For example, you guys know we will be discussing TNF inhibitors. Like you guys know, TNF. Okay, what's the function of TNF?
Acute inflammation.
Okay, it, acute inflammation. It's basically one of component of acute inflammation, and it's going to recruit different immune cells,
Cytokine.
right? Okay,
Yes.
okay. So so it's going to act on certain receptors, right? Okay, once, okay, for example, this is your cell. TNF alpha is going to act on receptors, and ultimately it's going to release cytokines, and they're going to recruit immune cells. So, for example, if I am making certain antibodies which targets these receptors, okay, if I am making certain antibodies that are targeting these receptors, it means I am inhibiting the downstream effect of TNF, right?
Yes.
Okay, so we'll be talking about these antibodies. What are that? Okay, so examples of TNF antibodies are, if I am just producing these monoclonal antibodies, it means in the end they'll be having the suffix of mab, right? So you know half of their name. The other half we are going to make mnemonics for that. So what are examples of TNF inhibitors? That is infliximab, okay, adalimumab, infliximab, golimumab. Okay, so you guys must remember these three TNF inhibitors: infliximab, adalimumab, and golimumab. Right? Hello.
Yes. Yes.
Okay.
Yes, sir.
They are going to sit on this receptor, and ultimately, okay, what's the idea? You guys know they are going to sit on this receptor, and ultimately, what are they going to do? They are going to inhibit the downstream effect of TNF, that is recruitment of immune cells. So I'm suppressing the immunity, right? Okay. Secondly, what can I do? One approach which I can have is to block the receptor. Second approach, just divert these TNF, okay, and put some receptors. These receptor, give them some receptor that are roaming around here and there in your blood. So all of these TNF are going to bound to that receptor. So again, the idea is you are again decreasing the downstream effect of TNF. Hello.
Yes. Yes, doctor.
Okay. Okay. Yes, we are trying to decrease the acute inflammation. So we have two approaches. First approach, okay, just let me change my pencil color. Okay, first of all, just give them antibodies and block this receptor. So TNF cannot act on it. Simple. Secondly, just decrease the concentration of TNF. Okay, just give them the same receptor, but that is revolving inside your blood. So what will happen? All of these TNF are going to be diverted. They are going to bind to this receptor, and again, you won't be seeing the effects of TNF. So what's the name of this? Okay, basically it isn't a receptor. It's a fusion protein. Fusion protein. Same as these receptor. What's the name for that? Etanercept. Okay, you guys have seen MCQs in few words related to etanercept, right? Hello. Yes. Yes. It's an analog of this receptor. Simple. Okay. Okay. So infliximab is basically a chimeric form. Chimeric form, that is like a non-humanized form, right? And you have the other two are humanized form. These two are humanized form. So anyone who can make good mnemonic for this? Yes. Okay. So, okay. So we had a guy named Adam. He was watching Netflix, right? Okay. So those who are like Pakistani and Indians, do you know what is goalie? Goalie is basically for bullet. Bullet is your goalie, okay? Okay, and he was hit by a bullet, goalie. Okay, because he was wasting his time. He had US Assembly step one in December and he was watching Netflix. So, like, his father just killed him, okay, with bullet, goalie. So, Adam hit by bullet. So, in Netflix for infliximab, right? It's sound same. Hello? Okay. Infliximab, Adam for adalimumab, and golimumab. Yes, they blocks the TNF receptors. Okay, and Netflix, human watches Netflix, yeah. Animals do not watch Netflix, so it's the humanized form. Okay, so this is the mnemonic. Okay, anyone who can just give a good mnemonic for this Adam Netflix, anything like that. Guys, this was your task. You guys are going to make the mnemonic. Yes, Adam and this goalie is chimeric form. Yes, yes. Okay, he was watching some gorilla movies, right? That King Kong or what. Okay. Yes, on Netflix. Gorilla, right? So Adam, Netflix, and Gorilla. It should make you remind that adalimumab, right? Adalimumab, Netflix for infliximab, and Gorilla for your golimumab, right? Gorilla, it's an animal, chimeric form. Adam is also an animal. Human are animals. Okay, just kidding. So Adam and Gorilla, you must remind that chimeric form, and Netflix is your humanized form. Okay. Sorry if my mnemonics are lame. Sorry for that, but at least I'm trying. Okay. So, for example, if you are giving a person with TNF inhibitors, so what would be the adverse effect? Okay. If I'm giving them TNF, it means I'm decreasing the immunity, right? So it can reactivate some of the latent infections. Let's suppose TB. Okay, so this is high yield adverse effect. You guys must know that. So before giving a person TNF inhibitors, you must screen them for tuberculosis, right? If they have latent infection of tuberculosis, because TNF alpha, you have a lot of MCQs based on this concept in your work. You guys would already have done those MCQs, right? For example,
Sir,
if a
please
person,
repeat.
sorry,
Please repeat.
okay, so right from the beginning or this TNF.
No, this TNF inhibitor
Okay.
TB.
So you know that TNF is basically like it's going to recruit your immune cells, including macrophages, right? Hello.
Yes.
Okay.
Yes.
You guys know that basically the macrophages and granuloma, that goon complex, basically it form a goon complex. The macrophages are involved mainly, yeah, right?
Yes.
Because you're going to see granuloma. If I'm giving them TNF inhibitors, it means I'm decreasing the macrophages activity as well.
Yes.
So, for example, if a person is having latent infection, so it can reactivate, right? You can see reactivation of the latent TB. So, before giving them TNF inhibitors, you must screen individuals for tuberculosis. Okay. Anyone who can just give us an overview of TNF inhibitors, please? Yes. 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 Yeah. Yes. Yes. That is etanercept. So simply you can just make a mnemonic that it is etanercept is eating your TNF, right? Yes, etanercept eats TNF. Okay. Yes, perfect. And TB, Association of Tuberculosis. Yes. Okay. So now let's discuss another anti. Okay. Okay. So this was all about TNF inhibitors. These are very high yield. You guys must know that. And now let's discuss some other monoclonal antibodies. Now you are going to make some mnemonics here. Okay, monoclonal antibodies. Okay, the first one is natalizumab. Natalizumab. What's the target? Target is alpha 4 integrins. What is alpha 4 integrin? Simply, you can remember of that it is an adhesion molecule of your inflammatory cells. So if I am targeting that with monoclonal antibodies, it means again the function of your inflammatory cells is decreased, right? So it suppresses. Okay. Hello. Are you guys getting that? Like it's an adhesion molecule. Basically, your inflammatory cells use these adhesion molecules in order to have the effects. So if I am blocking off this alpha integrins, it means the effect of all of your inflammatory cells is going to be decreased, like your lymphocytes, right? Your B cells, your T cells. Okay. So what is the high yield indication of natalizumab? It is you are basically going to give it in multiple sclerosis. You know, multiple sclerosis is an autoimmune disease in which you are going to see destruction of your oligodendrocytes, right? So I'll give them natalizumab in order to inhibit the downstream effect of these inflammatory cells, that is T cells, mainly by blocking the or these antibodies are against alpha 4 integrins. Simple. Okay, what are some high yield adverse effect? It's basically reactivation of your JC virus. Okay, we'll be discussing the JC virus in details in our neurology, but till now you must know that what does JC virus do? It causes some neurological deficits, seizures. Okay, so neurological encephalopathy. So it's going to like it's basically related to your central nervous system lesions. Simply. Okay, so anyone who can just give like make a good mnemonic for this monoclonal antibody, natalizumab. Yes. Or if you guys do not need mnemonics, so we can proceed further. Just
Sir,
think of.
proceed further.
Okay, proceed further. Okay. Another drug.
Doctor, can you explain the mechanism of action of this last drug?
Okay. So, like the mechanism of action of all of these monoclonal antibodies are that it's same as the TNF inhibitors, monoclonal. Like they are
Yeah,
going
but
to
what's that? Alpha
okay
adhesion
alpha
means
4
something.
integrins. Alpha 4 integrins. You can simply remember of. They are adhesion molecules for your inflammatory cells. Like for example, your lymphocytes. Like lymphocytes are going to act, they are going to bind to alpha 4 integrins on the cell, then they are going to undergo their functions. If I am just giving that an antibody against alpha 4 integrins, it means I am blocking off the effect of lymphocytes simply. So in multiple sclerosis, basically I give this drug. Why? Because in multiple sclerosis and autoimmune disease, right? So I'm just blocking off the effect of lymphocytes which are destroying your oligodendrocytes, and it can lead to Okay, you guys have to practice it via, like, the only way to remember these drugs is to practice them. Activate your Anki cards and just do it again and again. Okay, there is, or just make some mnemonics for it. Okay, then you have rituximab. Rituximab is going to, okay, what's the target for rituximab? It's CD20. The mechanism is same. If I am just giving an monoclonal antibodies against CD20, so CD20 is basically related to your B cells, right? Okay, so it can be used in many diseases, right? Like many autoimmune diseases, in order to inhibit the activity of your B cells. And it also causes reactivation of your JC virus, simply. So, mnemonic for rituximab, there is two, right? Read two. Two for 20. Rituximab. So rituximab is going to target. Okay, you guys must know the target only. Okay, the target and some of the adverse effect. Like this is sufficient for your exam. You guys might have practiced MCQs related to it in your world, guys. Okay, so rituximab, it's going to target CD20. Then you have palivizumab. Okay, palivizumab. Okay, what's the target? It's RSV F protein. Okay, like simply you can think of that respiratory syncytial virus, which is like going to cause pneumonia uh, in children, right? Okay, so you can simply think of that it's a kind of like I'm giving them a passive immunity. It's something related to passive immunity. For example, in tetanus, we just give them tetanospasmin. Okay, that's like giving them a passive kind of immunity, right? Giving them antibodies kind of thing, right? So you can simply think of, for example, if one have RSV, some children, so just give them RSV monoclonal antibody protein in order to like save them from RSV infections. Simply, RSV prophylaxis. Okay. Yes, it inhibits the effects of RSVF protein, and as a result of that, it can be used as prophylaxis of RSV, right? Okay. So, okay, guys, just try some mnemonics. We can just make mnemonics, I guess. Televizumab for RSV. Okay, just
So for
please.
RSV, I have one mnemonic in my mind.
Yes, yes, please.
So we can make that mnemonic RSV. We can use it for reservation.
For
So reservation. The short
okay,
form of
reservation.
reservation is RSV.
Okay,
So we can say that Talibi is a person who reserved um, at some, Franklin Port, something like that, or
okay,
Franklin Forest
okay,
Protein. So he reserved his hotel. We can say
okay.
Franklin Port Hotel.
Paul
So Pali
is
reserved hotel.
reserving. Paul is reserving a hotel.
F
Okay,
Franklin
okay,
Port or
okay. So Paul is reserving some hotel, right? So Paul for television. Yes, food. Paul is reserving some food, right? Some protein
yes,
food. Perfect. Yes, guys. Okay, we will be making mnemonic for this as well. So Paul is reserving food. So
protein.
palivizumab, Paul palivizumab is going to inhibit reserve for RSV reservation. Okay, RSV food, RSV protein. It's going to the target for Paul or palivizumab is your RSV protein, RSVF protein. Okay, perfect. So rituximab, there is a word two, right? And mab, like A O, mab. Oh. Okay, so it's going to target your CD20, that is related to your B cells. It's going to cause reactivation of your JC cells. Okay, okay. So any mnemonic for natalizumab? Okay, let's think of, guys. Have Yeah, yeah. Okay, Natalia is having multivitamins. Okay, Natalia is having 4 tablets of multivitamins daily, right? So Natalia for natalizumab, 4 for alpha 4, and multivitamins for multiple sclerosis.
Yeah, that sounds good.
Okay, Natalia is taking 4 tablets daily of multivitamins. Okay, so that's good. Thank you guys for helping me. Okay, so we are only left with some of the monoclonal antibodies. Okay, then we have another monoclonal antibodies. You guys are going to see a lot of MCQs related to this one. That is omalizumab, and it's going to target your IgE. Now you guys know IgE. If you guys remember asthma, allergic reaction, IgE is sitting on the surface of mast cells, right? So I can just, what are the indication? Asthma. Okay, any mnemonic.
So we can say that from Oman, we get asthma in Oman.
Okay,
So asthma, wherever it is asthma, it's related to IgE antibody, and Oman goes for omalizumab.
okay, okay. Oman or Omani people have asthma. Okay, we have disrespected a lot of countries. Sorry for that. Okay, so Omani guys have asthma. So and asthma have IgE. You guys know that. They're, you know, don't need a mnemonic for remembering IgE sitting on the surface of mast cells. So omalizumab is going to target your IgE and it is used in asthma. Thank you. That was a good mnemonic. Okay, then we have trastuzumab. You're also going to see an MCQs related to trastuzumab as well, very high yield. It's going to bind, or what's the target is HER2/neu. You know, HER2/neu is basically present on the surface of your cell, basically in the like breast cells, you know, cells in the breast. Okay, so whenever the expression of HER2/neu is increased, so it can cause breast cancers, right? And another
Yes.
thing which you guys have seen in MCQs while doing cardio, if you guys remember, trastuzumab also causes dilated cardiomyopathy. You have an MCQ related to it. And once you stop trastuzumab, the dilated cardiomyopathy can reverse. Okay. So any mnemonic for, okay, okay,
And side
I
The
have a
ones
dark
one
mnemonic.
comes to my mind. I have it, but I
Okay,
don't know
okay,
if
okay.
someone
Let
else
me
can.
give you
But fast
okay.
tracker
I have
have
a
it.
mnemonic. I have a mnemonic in mind. You know, transgender, they are
What's
basically
that
a
mean?
her, right? Right? They are not
yeah.
he, they are her. Okay. Okay. So trastuzumab for her to new. Okay, and her, they are basically used in breast carcinoma. Okay. Okay. So then you have, okay.
So they suppress this. What this drug do?
Sorry.
What's the function of this drug? Trastuzumab.
Okay, so this drug is going to bind to HER2/neu, and basically it can be used in breast carcinoma, because what happens in breast carcinoma, you will be seeing increased expression of HER2/neu. HER2/neu, and increased expression of HER2/neu is going to increase your cellular growth, causing the breast cancer. So the target would be HER2/neu, and this drug, in order to decrease the downstream effect of HER2/neu receptor, right? Hello.
Yes. Yes.
Okay. So this was a mnemonic transgender for her. Okay, so we'll be discussing two more drugs. That is, okay, these are your high yield. Okay, eculizumab. Eculizumab for What's the target? It's C5. If I'm targeting C5, I can use it in PNH. You guys know what happens in PNH. But what's the down adverse effect? Adverse effect is bacterial infection, encapsulated bacterial infection. You guys know that because we have already done it. In PNH, what happens? You have less DAF. It means that your complement system is going to kill off your cells, your red blood cells, right? So just give them, just block the activity of C5. And C5, you know, it's a component of your membrane attack complex. So I can do that, right? Hello. But once I have decreased membrane attack complex, so there is increased chances of encapsulated bacteria, right? So
Yes.
any mnemonic for this? Yes.
So we can say, so E. coli is a bacteria. So we can say E. coli related to encapsulated bacteria.
Okay, E. coli is destroyed by your complement, you can say.
Yes, that resembles it.
Okay, so your E. coli, eculizumab. Okay, E. coli. Let's make another mnemonic. Okay, okay. E. coli sometimes cause bloody diarrhea, right? Okay. E. coli causes bloody diarrhea, right? And your complement system basically destroy your E. coli. Simply, you can think of like that. Okay, we are just uh, damaging all of the medicine, but sorry for that. Okay, E. coli causes blood for PNH. You are going to see blood, red blood cells destruction, right? If you are destroying the blood, okay, E. coli, eculizumab, complement system for your C5, C5 or complement C for C5. Okay, so E. coli, bloody for your PNH, right? Destroying your red blood cell and complement. So these were the high yield uh, monoclonal antibodies. So we are done with them, and like it was very hard to make these mnemonics, but let's have revision. Okay, based on the mnemonics, we will be discussing mnemonics. And doctoral futures or anyone who can just write down these mnemonics, please, and just do the description of that. So it would be quite helpful for all of the students, those who have taken the class and those who haven't. Okay, so first of all, we have TNF. Okay, doctoral futures, please tell us some TNF inhibitors. Hello, hello, anyone?
Adalimumab, golimumab, infliximumab.
Okay, so basically, Adam is watching Netflix, and he's hit by Goli, or he's watching some gorilla movies, right? So Adi, okay, what's that? Adalimumab, Golimumab, and Infliximab, right? Okay, what about eating your TNF?
Etanercept.
Etanercept. Okay, perfect. So then we have, okay, TNF. Okay, okay. Then we have Natalia. She's taking 4 multivitamins daily.
Natalizumab for alpha 4 integrins molecule.
Okay, multivitamins used in multiple sclerosis.
Yes.
Reactivation of JC virus.
Yes.
Okay. Then you have Paul have some reservation of food, protein food.
Valmivza for prophylaxis of RSV virus against the protein RSV4.
RSVF protein food. F protein. Okay. Then we have Omani people having asthma.
Omalizumab for IgE.
Omalizumab for IgE treatment asthma. Okay. Then transgender her
Trastuzumab for HER2 proteins.
heart renewed. Okay. Then we have eculizumab.
Includimab for C5, and which is used in PNH.
Okay, and
E.
what's
coli.
the adverse effect? Encapsulated bacterial
In-
infection.
yes.
Okay, so it was all about the drugs. Hope so you guys enjoyed. Like
Doctor,
right
what
now.
was the function for natalizumab?
Okay,
Mnemonic for
natalizumab, Natalia. Okay, let's write down these mnemonics. Okay, let's do the mnemonics. So, first of all, your Adam was watching Netflix and he was watching some gorilla movies, right? King Kong. Okay, so adalimumab. Adam is human. It means it's human. Okay, Adam is animal. Sorry. So it means it's a chimeric form. Netflix for infliximab. Okay, Netflix. It's a human form. And gorilla for golimumab. Right? Then you have Natalia taking 4 multivitamins. So your natalizumab, natalizumab alpha 4 integrins used in multiple sclerosis. Then you have Paul. He's having reservation for some food, protein. So pavlivizumab for reservation for RSV F protein, and it's basically used in RSV infections. Okay, then you have transgender her. Okay, so trastuzumab is going to, what's the target? HER2 new, used in breast CA, right? And it can also cause dilated cardiomyopathy. Okay, then we have, okay,
Rituximab.
Omani having asthma. So omalizumab IgE used in asthma. Okay, then we have E. coli, bloody, and complement. E. coli for eculizumab, blood for PNH, used in PNH, and it's going to target your C5. Okay. So this was the mnemonics. Anyone who, okay, Dr. Obada, please tell us the mnemonics and just tell us the biological immunotherapy.
Adam Netflix Gorilla movie.
Okay.
TNF alpha inhibitor. Adalimumab, infliximab, golimumab. Adam for adalimumab, Netflix for infliximab, and Gorilla movie for golimumab.
Yes,
Adam
perfect.
is
What about eating your TNF?
it causes TB reactivation.
Okay, if I'm eating my
Yes,
TNF, etanercept.
etanercept.
Etanercept. Okay. Okay. So then Natalia taking 4 multivitamins.
Yes, natalizumab acts on for alpha 4 integrin. It inhibits it, and multivitamin for multiple sclerosis. It's used for
Okay,
multiple
and
sclerosis.
what's the adverse effect? JC virus
G-CEP
activation.
virus reactivation. Yes.
Okay. Then Paul have some reservation of food, protein food.
Balivizumab used
Bali.
balivizumab against RSV F protein used in RSV infections.
Okay. Then what about transgenders?
Uh, Trastuzumab against HER2 used in breast cancer and causes dilated cardiomyopathy.
Okay, perfect. What about Omani people having asthma?
Omalizumab used in asthma. It's against IgE.
Okay. Okay, perfect. Okay, what about E. coli?
E. coli for eculizumab. It causes bloody diarrhea for BNH, and it used for BNH, and it causes that leads to complement activation C5.
Yes, targeting C5. Okay. So this was all about the immunosuppressants. Guys, hope so you enjoyed. Like we had another level of approach today. Hope so you guys enjoyed. Yeah. Okay, so I'll be activating um, your assessment today, right in 1 hour, and you have 3 days for that assessment. Today we are going to share the task um for your MSK, right?
Yes.
Dr. Ramesh, where were you? We just did the immunosuppressants.
So can you please keep
Yeah,
assessment open for Monday? As you said, it would be on Saturday, so Saturday to Monday or
Saturday, Sunday, and Monday. So we have 3 days. Yes, it would be on Monday.
it was mentioned in the class, like in the group, that assessment will be started on Saturday. So that we are
sir,
expecting that.
according to EST timings, approximately exactly 3 days from now or Monday full day. How?
Okay, I'll just activate it for 5 days. Is that good?
Okay, because we have Diwali celebrations as well and
Okay.
Halloween.
Okay, no problem. It's activated for five
Thank you
days.
so much, sir.
Okay.
Thank you for
Thank
this
you.
cancer drugs lecture. It was amazing.
Okay, thank you guys. Thank you guys. Hope so you enjoyed. Thank you.
Yes, yes. Thank you, doctor.
Okay.
Okay.
Bye
Bye.
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 Right.